must begin, of course, by thanking the Governor for being so kind and generous in his presentation of this remarkable award, as well as for the outstanding support he has given to Johns Hopkins Medicine throughout his administration, including the fulfillment of a $100 million commitment towards the $1.1 billion redevelopment of the Johns Hopkins Hospital. This project, which just completed nearly 2 years ago, has enabled us to replace more than 1/2 of the hospital beds in some of the oldest buildings on our East Baltimore campus, with 560 new private rooms, as well as new ORs, new intensive care units, emergency facilities for both adults and children in 2 interconnected towers. One tower dedicated to children is named after the mother of Michael Bloomberg, Charlotte R. Bloomberg. And the adult tower is named after the first president of the United Arab Emirates, Sheikh Zayed. Very interesting juxtaposition. Charlotte Bloomberg, Sheikh Zayed. Very interesting indeed, but quite representative of the diversity of those to whom we render services, and as well the diversity of the philanthropic community we continue to enjoy as supporters of the Johns Hopkins institutions. We see patients in these world-class facilities from historic East Baltimore in accordance with the directive of the founding father, Mr. Hopkins. We see patients from all corners of the state of Maryland. Increasingly, we see patients from all parts of this country, and in the last several years, we are now seeing patients from 60 countries who come knocking on our doors for the services that we offer. The Governor has long demonstrated his unwavering belief that Johns Hopkins Medicine's mission of providing exceptional medical care, undertaking innovative research, and educating the physicians and scientists of the future not only benefits those of us who live in Maryland, but the hundreds of thousands of individuals overseas who are being helped by Hopkins-affiliated medical centers around the globe. We take a great deal of pride knowing that Johns Hopkins Medicine is perhaps one of the best-known, most admired exports of our great state. Now, perhaps I should pause a moment and explain exactly what I mean when I refer to Johns Hopkins Medicine. I say that because of practical matter, there are so many different Hopkins entities. Well, it's really quite simple. Johns Hopkins Medicine is the formal alliance of the Johns Hopkins Health System and the Johns Hopkins University School of Medicine. Now, you may ask what is the Johns Hopkins Health System. The Johns Hopkins Health System was incorporated in 1986, and the trustees of the Johns Hopkins Hospital determined that it would be necessary to create a holding company in anticipation of the market-driven need to acquire or create elements of a vertically integrated delivery system. The health system serves as the sole member of the wholly owned hospitals or other health entities of which the Johns Hopkins Hospital is the flagship. Now, I serve as the president of the Johns Hopkins Hospital and Health System, and since '97, I have been the inaugural executive vice president of Johns Hopkins Medicine. The dean of the School of Medicine also serves as CEO of Johns Hopkins Medicine. Now, if you're totally confused, don't feel bad. Paul Rothman's in the audience this evening. He's been with us for 2 years. He's still trying to figure it out. Johns Hopkins Medicine today has grown to be a $7 billion a year enterprise, and we now employ 41,000 individuals, 36,000 of whom live and work in the state of Maryland. So here we are in the Jim Rouse Visionary Center. There could not be a more appropriate venue for this evening's event. Visionary is a one-word embodiment of Johns Hopkins Medicine's philosophy since the founding of Johns Hopkins Hospital in 1889 and the Johns Hopkins University School of Medicine in 1893. We may come back to that theme, but let me address as well the Hopkins-Rouse, the Hopkins-Jim Rouse connection. When I arrived at the Johns Hopkins Hospital in 1973 as a wet-behind-the-ears administrative resident, Dr. Robert Heisel had just ascended to the directorship of the hospital. He had served ably as the director of all of the outpatient clinics at the hospital since he was recruited from Vanderbilt in 1968 and became quite well known for his progressive thinking about health maintenance organizations. when the visionary Jim Rouse set out to develop his planned community of Columbia, Maryland, he was desirous of including a pre-planned health plan and a community hospital for the future residents of his planned community. So he reached out to the Connecticut General Insurance Company and Bob Heisel from Johns Hopkins to orchestrate the initial planning. By the early 1970s, the first phase of what would ultimately become Howard County General Hospital was well underway, and the precursor to the Columbia Medical Plan was formed, and as they say, the rest is history. Now let me go all the way back, if I may, to the very beginnings of our medical institutions. The founders of our hospital and medical school were truly inspired by the vision of our original benefactor, Baltimore businessman Mr. Johns Hopkins, who unfortunately will not live to see the actual operationalization of the hospital. But Mr. Hopkins had the revolutionary idea that by creating a symbiotic relationship between a world-class hospital and a university-based school of medicine, it might be possible to create a degree of excellence in medical care, research, and education that would not only enhance medicine in America, but might very well influence medical care throughout the world. That was his vision. And to fulfill that vision, the very first chair of the hospital's board, Francis P. King, recruited John Shaw Billings to oversee the design of the hospital, as well as to facilitate early thinking about the organizational configuration of the institution. Billings was an Army major. He was a former Union battlefield surgeon and member of the U.S. Surgeon General Office. He was an organizational genius who established what would become the National Library of Medicine and the Index Medicus, and had published extensively on hospital design and management. Billings went to the top of what was then the best in medicine around the world, making several trips to Europe, seeking advice, and even sought counsel from Florence Nightingale on how best to design the Hopkins Hospital, sending her its original blueprints, and she in return actually responded with 12 pages of notes on how she thought it could be improved. Within a few years of its opening, Johns Hopkins Hospital, Johns Hopkins University School of Medicine collectively became the most respected academic medical center in the world, following the publication of the famous Flexner Report in 1910, which was commissioned by the Carnegie Foundation, a model of its kind. Johns Hopkins became a medical mecca to which patients, both humble and exalted, flocked from around this country and overseas. For example, the King of Siam was one of the more renowned patients in our Wilmer Eye Institute. And Hopkins' reputation for advanced treatment of complex cases of every description even captured the imagination of one of the early 20th century's most celebrated members of the European royalty, Queen Marie of Romania. The Queen was visiting Johns Hopkins in 1919 and reportedly knocked on the office door of Dr. Adolf Meyer, the internationally famous head of our Phipps psychiatric clinic. She said she had long wanted to meet him, and she introduced herself as the Queen of Romania. Meyer is said to have replied with his usual courtesy and appearance of genuine concern. And he asked, "And how long have you felt that way?" The exporting of Hopkins' medical philosophy, which began as early as 1915, when a commission headed by Dr. William Henry Welsh, who was the first director of pathology, who would then go on to lead the medical school as the first dean, Welsh went to Peking, now known as Beijing, China, to study the operation of the Peking Union Medical College Hospital. Under Welsh's guidance, Peking Medical School and Hospital were reorganized along Hopkins lines, even with women medical students being admitted. And today, what still is called the Peking Union Medical College and its hospital are acknowledged as among the finest in the world. Although overseas outreach has been part of our mission for nearly a century, we began a concerted effort to attract more international patients to Johns Hopkins in the mid-1990s. And in 1998, under Dr. Edward Miller's leadership, we entered a new phase of global healthcare by signing an agreement with the government of Singapore to provide care, lead collaborative research, and offer medical education there. This led to the creation of the Johns Hopkins Singapore International Medical Center. Then in 1999, we centralized all of our international initiatives and activities by creating what now is known as Johns Hopkins Medicine International, or JHI for short. Its growth under the able leadership of Steve Thompson and his colleagues has been explosive. Today, JHI employs nearly 300 people, and these individuals are involved in the oversight of relationships in 20 countries, predominantly in the Middle East, Asia, and South America. As well, they provide a unique set of services for international patients who travel to Johns Hopkins for their care. In addition to those who are employed directly by Johns Hopkins International, each year several hundred faculty of our School of Medicine and executives and nursing leaders participate in a number of international initiatives. And these international relationships include hospital management agreements, they include knowledge transfer agreements, and a variety of other consultative arrangements. In the United Arab Emirates, for example, we've had the responsibility of managing 3 major hospitals. Since 2010, Johns Hopkins Medicine has been involved in the development of the first American-style 4-year graduate medical school in Kuala Lumpur, Malaysia. And most recently, Johns Hopkins has entered into a joint venture with Saudi Aramco, the national oil company of the Kingdom of Saudi Arabia. A little over a month ago, Dr. Rothwing, Steve Thompson, and I, and other colleagues went to Tehran, Saudi Arabia, to participate in the celebratory event and first board meeting of that joint venture. Now, Saudi Aramco is the largest oil company in the world with net asset value in excess of $10 trillion. They generate revenue in excess of $1 billion each and every day. The purpose of this joint venture, known as Johns Hopkins Aramco Healthcare, is to manage the entire healthcare needs of 350,000 employees, dependents, and retirees of Saudi Aramco. We strive to uphold the mission of Johns Hopkins Medicine, which is to improve the health of not only the local community, but of the world, by setting the standards of excellence in medical education, research, and clinical care. And so at this point, let me wrap up by saying once again that I must thank our governor, the members of the World Trade Center Institute, for this prestigious Governor's International Leadership Award. I am honored and humbled to be the recipient, knowing as I do that in giving it to me, you're actually honoring all that Johns Hopkins Medicine is doing to advance medical care, research, and education throughout the world. We are proud to be among Maryland's best known and most admired exports. We plan to continue meriting the honor you bestowed this evening by maintaining our long-standing mission to improve the health of people everywhere. Thank you again, and thank you for being here this evening.